We're back talking with Dr. Bilski, and we have been talking a bit about implants and such, and it's kind of neat what's going on in dentistry these days. But the question I have is, how long does that take? If I go into the chair, how long does it take to get an implant?
Let's just say you're missing a tooth. We call that a healed site. Everything's good. You're healthy. No concerns. Okay. All right. We schedule an appointment for 90 minutes. 90 minutes.
I'm walking out in 90 minutes, and I've got an implant.
Yeah, an implant, dental implant. Looks something like this. You come on in. We would have had a consultation, looked at the x-rays, made measurements, talked to you about the procedure. You say yes, you come on in. If you are just okay with everything, you don't need any sedation or what we call happy pills, a sedative to make you feel a little bit more relaxed. We just use Novocaine and we inject just a little bit around the site where we're working. It's not this tremendous, huge numbness that you hear people talking about, but I get it. It's the dental office, and we inject, wait a few minutes, 10 minutes. Sometimes make an incision. Sometimes we use what's called a tissue punch. I call it the cookie cutter. I think that's pretty explanatory. And then we can see where we're placing the implant, and the procedure is done usually within 10 minutes or so. We place the implant. We have a device called the Ostel unit, which gives us initial stabilization quotient, ISQ. And that tells me how stable that that implant is in that jawbone. And the number we want is greater than 70. That's called a vertical component. The horizontal component is when we turn it in, like when you turn a screw in.
Yeah.
That's called torque. Real simple. And anything over 35. So if we get a 35 torque plus a 70, in theory,
that's good.
That's awesome. We can put a tooth on that day.
Wow.
Yeah. So can you have a tooth in a day? Yes, you can. Can you have all your teeth taken out and put implants in and walk out with?
Probably not.
No, you can.
In a day.
In a day. It's a long day. But it can be done. Yeah, for sure.
Wow.
And that's a long consultation, and we want to make sure you understand everything.
Yeah.
But as far as that procedure, it is now, that's for a healed site. Say you have a tooth that you can't fix it. It's terminal. So same thing, you come in, we numb you, remove the tooth, provided the bone is not disturbed. We call that, it's an oxymoron, atraumatic extraction.
Okay.
I'd like to have some patient tell me if that was atraumatic or not, but the technique itself and the physical nature of how we take teeth out is not traumatic to the jawbone. So now we have this opening, a hole, and we're putting in like a molar, which is the most common, we're putting a round peg into a square or rectangular hole. And provided that we can get that tightened in there pretty well, then we do a little grafting procedure around that, put the ISQ smart peg on that. It's a 70, it might be a 40. It tells us what it is. Torque value could be 35, could be 50, could be 20. It gives us all the indications of what's going on. That appointment may be maybe 2 hours.
Wow.
Depending on the severity and on the difficulty of what we're trying to accomplish.
Wow.
But anywhere from 90 minutes to 2 hours.
I just figured it was like at least a half-day thing, and
well, unfortunately, it can be if.
But the thing, I just figured that's like minimum. That just seems like a lot going on. It's amazing.
Your garden varieties are going to be within that 75 minutes, for single. And a lot of times, patients are very easily anesthetized and we're able to perform the procedures like very quickly. It's just very nice to have that patient. And sometimes we can put 3 implants in healed sites within 60 to 90 minutes, and which is nice for the patient. We have a little bit more time to speak with you. They're not sedated, so they're conscious. And then we have the patients that are sedated, and we bring an anesthesiologist into our office and go from there. So that takes a little bit more time.
Well, but you can handle anybody, and no matter how you feel about getting implants, or if you're scared, or these guys, you guys can handle anybody, and pretty much handle anything.
We call it trying to do everything under one roof, but we also are equally as proud of what we don't do.
Yeah.
As what we do. There are limitations. There are expectations from patients that are not achievable even in the specialist's hands.
Yeah.
So we will ask our specialty people to also consult with these patients and explain to them what the potential problems can occur with these procedures. But for the most part, yes, to answer your question, and we try to do as much in office as we possibly can. We feel comfortable with the procedures that we provide, and the ones that we don't, we recommend other doctors.
Well, and I know with some of the other subjects, which you can watch on their website at bilskidental.com. You really you get to know the patients. I mean, it seems like an obvious thing, but you really do, and their comfort level of things and everything, and that's really important too.
We try not to rush, especially when patients are coming in and they really are nervous about the procedure.
Yeah, sure.
And just because I do it every day doesn't mean that I can just laissez-faire come on in and, okay, this is what we're doing, I'm in and out in 5 minutes. No, that doesn't work. Yeah. For me, it doesn't. We're relationship-based practice.
Yeah.
And then once you come through our system, I guess, or our business model and how we practice dentistry, I think you kind of see that. Now,
well, hey, I know
people are people, right?
No, I know, but I know you mentioned, you've got the folks who you're seeing their kids and even their kids' kids, the grandchildren. That's a real testament.
Yeah, I don't think I'm at the point where I have in other words, a great grandma.
Let's get there. Let's get there. That's the goal.
If I work long enough and live long enough, we'll have that for sure. That'll be in the next video.
Well, thanks a lot for sharing, Dr. Bilski. Appreciate it.
Thank you.